Well, I'm happy to be able to share some good news today. News that the decline in Ohio's COVID-19 cases, a decline that we've seen over the last few weeks, has in fact continued. And in some areas of the state, that decline has even accelerated. Just a month ago, Cuyahoga County had a rate of 3,000 cases per 100,000 residents. That number has now plummeted to 189 cases per 100,000 residents, a sharp and welcome drop. The number of people hospitalized with COVID-19 also continues to decline. Ohio saw a peak of over 6,700 people in the hospital on January 11th. As of yesterday, that number has gone down by more than half to just over 2,800. Significantly, just in the last week alone, the state's hospitalization numbers have declined by 18%, a further sign that the Omicron wave is in fact receding about as quickly as it arose. Now, just about every region of Ohio is experiencing this drop in cases and hospitalizations, although parts of southern Ohio, where Omicron peaked much later than in the Northeast, haven't yet seen as sharp a decline. The drop in hospitalizations has allowed more hospital systems to resume a full scope of services, including performing elective surgeries, which many hospitals had to suspend for a time during the Omicron surge as it taxed their resources, especially their human resources. As the pressure on hospital staff is easing in more areas of the state, this has allowed some of our National Guard members who stepped up at a crucial moment to provide essential support to our hospitals to head back home and back to their regular occupations. At the peak of Omicron, about 2,000 Guard members were deployed at 62 hospitals and 18 testing sites all around our state. This has been an extraordinary intervention and one that's made a big difference for so many hospitals and the communities that they serve, including reducing pressure on our vital emergency departments. As of Tuesday, the number of Guard members deployed across Ohio had declined to about 1,200, serving at 28 hospitals and 13 testing centers. But while the National Guard may be reducing its presence in our hospitals and our testing centers, it's certainly not the time for us to let our guard down. Although our case numbers have in fact substantially improved from our Omicron peak, it's important to put our current numbers into some perspective. Remembering that a case rate of 100 per 100,000 people is considered high, Ohio's overall case rate remains at more than 5 times that number. And our highest counties are in fact still close to 20 times that benchmark. So while there's no doubt we are quickly moving in the right direction, it's simply too early for us to declare victory, given the reality that thousands of Ohioans are still being diagnosed with COVID-19 each and every day. In the meantime, we need to remember that we have many important tools at our disposal to protect ourselves, our loved ones, and our communities, as there remains a lot of virus out there in the community. Wearing a mask, particularly in many crowded indoor environments, may still be a wise choice. And of course, getting vaccinated remains the very best way to safely minimize your risk of developing a serious illness related to COVID-19. Getting vaccinated also means that you'll join more than 60% of eligible Ohioans, those ages 5 and older, who have now also been fully vaccinated. That's a number of more than 6.6 million people. But while getting your primary vaccination series is a great step to protect your health, it's not the final step. As with many other vaccinations, keeping your protection against COVID-19 up to date includes getting a booster shot when that's needed. As we transition from living through a COVID-19 pandemic to something we're better able to live with safely, getting a booster shot on time is an important part of keeping our immunity strong. Indeed, the Centers for Disease Control and Prevention, in looking at experience with the Delta and the Omicron surges, has reported that people who got their booster when it was time were in the best protected position against illness resulting in hospitalization. And staying up to date with a COVID-19 booster really appears to be particularly important for those who are over 40 or have certain underlying health conditions. Today, of the 6.6 million Ohioans who are in fact fully vaccinated, nearly 3.3 million have received a booster, which is good news. But it also means that there are millions more of us who might still be eligible to receive a booster.